Okay, let's become familiar with some of the anatomical landmarks on the posterior or dorsal surface of our specimen. So this is going to be a review of structures that you will encounter as you remove the skin and superficial fascia or subcutaneous fat from the posterior aspect of our specimen. We will need to place her in the prone position, so she will be laying on her ventral surface, and we will have the dorsal surfaces exposed for our work. Now let's go ahead and take a look at some of the anatomical landmarks here that are muscular. Okay, this is our trapezius muscle. This is our deltoid muscle. The deltoid muscle has three heads: posterior, middle, and anterior. The infraspinatus is right here below the spine of the scapula. The inferior muscle in this area is our teres major, and between the infraspinatus and the teres major is the teres minor. The next muscle here is our latissimus dorsi, and with the teres major makes up the posterior axillary fold. Other muscles that you will be able to identify in this view are our triceps brachii. That is the long head. This right here is the lateral head, and the medial head is underneath the long head. Now, the one thing about the trapezius muscle, it has an attachment here to the scapular spine. Anteriorly, it also has an attachment to the lateral clavicle. Superiorly, we have attachment to the occiput, and inferiorly, not in this view, we have attachments to the thoracic vertebral spine. Here along this midline, the trapezius originates off of the spinous processes of the cervical and thoracic vertebrae. However, in the area from the occipital region to C7, there is a very dense ligament called the ligamentum nuchae, which is actually above the spinous processes, or superior, external to the spinous processes, between the trapezius, that the trapezius actually originates from. Let's go ahead and remove these. Actually, we don't need to remove these landmarks. Let's go ahead and actually change our pen color. Let's go to yellow for nerves, and right up here is the lesser occipital nerve. So you will find it going up and down in this area, and that needs to be preserved. Inferiorly, here is a vein on the medial aspect of the upper extremity called the basilic vein. That is going to be embedded in the superficial fascia, and so you will need to make sure you understand its location on you, as well as where it should be located on your specimen. Let's now take a look at this next view. Again, here is our basilic vein medially, and it will run medially on the brachium and antebrachium. So be aware. Also adjacent to it will be several nerves, and we'll discuss that in just a little bit. Again, let's just review some of the muscles that we see here. Posterior head of our deltoid. Here's our trapezius. Here is our supraspinatus. Ooh. Here is our supraspinatus. spinatus. Again, teres major. Here, teres minor. And here, latissimus dorsi. Here is the inferior aspect of trapezius, overlying this nice aponeurosis of the latissimus dorsi. This is indeed very thick, and as you do your dissection work trying to get underneath the muscles, you will find it exceedingly difficult to dissect it in that area. Here we are viewing the gluteal region, and this is our gluteus maximus, and up here, right adjacent to the iliac crest, is our gluteus medius. Gluteus minimus is not viewed from this aspect. We have some muscles here of the dorsal thigh. It's not easy to correctly identify them, but we'll do our best. The most medial aspect will be our gracilis muscle. Then adjacent to the gracilis would be our adductor magnus muscle. This side actually that I have the leaders to have had the superficial muscles faded out, and so we are able to even see our sciatic nerve in this view. So this is actually a view that has removed superficial muscles. So let's actually take a look at the superficial muscles here. Again, this is going to be our gracilis, the muscle that's going to be medial here and here is our semimembranosus and semitendinosus. Semitendinosus is actually sitting on top of the semimembranosus. Over here is our biceps femoris, and right here is our vastus lateralis. This here is our IT band. It belongs to the tensor fascia lata. Nerves are going to be something I want you to preserve in this area, and so there'll be some nerves that'll give you some problem, and they are associated with the gluteus maximus muscle. They're called your cluneal nerves, like George Clooney, cluneal. So we have superior cluneals, we have medial cluneals, and we have inferior cluneals. So they are going to come out and go over the external surface of the gluteus maximus muscle. Another nerve that I want you to identify and preserve is this nerve right here, which is the lateral cutaneous nerve of the thigh. And more specifically, the dorsal thigh. Now let's go ahead and advance. If you've noticed, we haven't had too many vascular surfaces that we've had to worry about preserving. But now, besides our lateral cutaneous nerve of the posterior thigh and our cluneals, we now actually see a nerve down here right adjacent to our biceps femoris, and that is going to be our common fibular nerve. The sciatic nerve is going to divide into the common fibular nerve and the tibial nerve somewhere between the gluteal region and our popliteal fossa. So it will divide anywhere along that length, and sometimes it has already made its division up in this region. Now, let's go ahead and point out this vascular structure right here. This is our great saphenous vein. You can see it on both sides. Emptying into the popliteal vein of the popliteal fossa is our small saphenous, sometimes referred to as lesser saphenous. As far as vascular structures, the great saphenous vein is going to empty into the femoral vein right by the femoral triangle, which is right by the inguinal area anteriorly. And as you can tell, it's running medially on the thigh, medial on the knee, and will continue down the leg medially until you find it adjacent to the medial malleolus. I want you to look on you and to assess whether the great saphenous vein runs anterior or posterior to the medial malleolus. We'll look at the small saphenous in just a little bit. Let's go ahead and remember, this is our gluteus maximus. We have our gracilis. And now it's easy to see right here, this is our semitendinosus and is lying on top of the semimembranosus. And between the gracilis semimembranosus is our adductor magnus muscle, which is laying kind of in this area, AM. Okay, here is our biceps femoris, here is our vastus lateralis, and up here in this area would be our tensor fascia lata. Remember, this area is the popliteal fossa. Let's take a look at this area on the medial aspect of the knee, and I want you to notice that the semitendinosus and the semimembranosus, as well as the gracilis, all come together distally in their tendons to form a tendon that is commonly referred to as the pes anserine, P-E-S-A-N-S-E-R-I-N-E. Well, that will conclude our podcast of the anatomy for now. This is part 1. Go ahead and start part 2 when you're ready.